So, good day everyone. My name is Giselle Alyssa Lanto and I'm a third year medical technology student. So, for today, I will be explaining to you what is a Neisseria, gonorrhea, and Chlamydia. So, for today's agenda, I will be introducing to you what is the disease, the effect of the disease, the screening test to diagnose the disease, the molecular test, if available, and also the treatment. So first, what is the history? The first use of the term gonorrhea, meaning a flow of seed, was in the 2nd century when the urethral discharge was mistaken for semen. Then in 1530, it was thought that gonorrhea was an early symptom of syphilis. The issue was further confused in 1767 because of a classic blunder by a physician who inoculated himself intentionally with pus from a patient with symptoms of gonorrhea. The pus, the pus gave the physician syphilis instead. Gonorrhea was also called the clap from the French word clapor, meaning brothel. So for the epidemiology, Neisseria gonorrhea, it is most commonly transmitted by sexual contact or intercourse. The primary reservoir is the asymptomatic carrier. Gonorrhea is second to chlamydia trachomatis in the number of confirmed sexual transmitted bacterial infections in the United States. There were 321,849 cases of gonorrhea reported in 2010, and also an increased rate of 4% from the previous year. Sexually active teens and young adults have the highest rates of infection. It ranges in women from 15 to 19 years old, then in men from 20 to 24 years old. So for the effects of the disease in men, acute urethritis usually resulting in purulent discharge and dysuria or painful urination is the most common manifestation. Asymptomatic gonococcal infection in men is uncommon. Only 3% to 5% of cases are asymptomatic. Neisseria gonorrhea strains with nutritional requirement for arginine, hypoxanthine, and uracil or the AHU strains are often isolated from asymptomatic men. Complications in male patients include ascending infections such as prostatitis and epididymitis, while in women, the endocervix is the most common site of infection. Symptoms of infection when present include the dysuria, cervical discharge, and lower abdominal pain. 50% of cases in women may be asymptomatic, leading to complications such as pelvic inflammatory disease, which may cause sterility, ectopic pregnancy or perihepatitis, or the Fitzhugh-Curtis syndrome. And also for other conditions, it includes anorectal or oropharyngeal infections. Pharyngitis is the chief complaint in symptomatic oropharyngeal infections, whereas discharge, rectal pain, or bloody stools may be seen in rectal gonorrhea. And for the newborns, ophthalma neonatorum, a gonococcal eye infection during vaginal delivery through an affected birth canal. This condition, which can result in blindness if not treated immediately. So in the first picture, as you can see, um it is a epididymitis which occurs in men which has an inflammation in their epididymis. While on the second picture, it is a perihepatitis, which is an inflammation of serous or peritoneal coating of the liver. It is often caused by one of the inflammatory disorders of the female upper genital tract known collectively as pelvic inflammatory disease. Some patients have sharp right upper abdominal quadrant pain. And for the third photo, it is a newborn with a ophthalmia neonatorium. So next is the laboratory diagnosis. So for specimen collection, specimen collected for the recovery of Neisseria gonorrhea may come from genital sources or from other sites such as rectum, pharynx, and joint fluid. In men, purulent discharge can be collected directly onto a swab for culture. When no apparent discharge is present, the swab is inserted up to 2 centimeters of the anterior urethra and slowly rotated to collect the materials. Swabs for rectal culture should be inserted 4 to 5 centimeters into the anal canal. Disinfectants should be avoided in preparing the patient for collection of the specimen. So for the screening test, direct microscopic examinations. Smears for direct gram stains should be prepared from urogenital specimens. So the picture shows a direct gram stain smear from male urethral discharge. So next is the culture. Chalk agar is the medium of choice in cultivation of Neisseria gonorrhea. It supports the growth of many other organisms found as commensals in specimen collected for the recovery of gonococci. A selective medium is necessary. So in the pictures, you can see it has a growth of Neisseria gonorrhea in the agar after an incubation. So for the non-culture methods, the molecular test, these methods detect gonococcal antigen or nucleic acid directly in urine or cervical or urethral exudates. Nucleic acid amplification test or the NAATS amplify a specific nucleic acids, for example, the polymerase chain reaction, before detecting the target sequence with the probe. So for the treatment, according to the 2010 STD treatment guidelines, cephalosporins or the ceftriaxone, cefixime, are currently recommended because co-infection with Chlamydia trachomatis is common in patients with gonorrhea. Dual therapy is frequently prescribed. One of the primary therapies for Neisseria gonorrhea is used plus azithromycin or doxycycline for Chlamydia trachomatis. So this is the reference that I use, which is the textbook of diagnostic microbiology. And that's all for the Neisseria gonorrhea. So now let us talk about chlamydia. It is from the family Chlamydiaceae, which is a genus of Chlamydia and Chlamydophilia. Chlamydia has a species of Chlamydia trachomatis, which has a clinical manifestations of urogenital infections, trachoma, conjunctivitis, pneumonia, and lymphogranuloma venereum, while in Chlamydophila pneumoniae, bronchitis, sinusitis, pneumonia, and possibly atherosclerosis, while in Chlamydophila psittaci, it has a pneumonia or the psittacosis. So for Chlamydia trachomatis, it is one of the 4 bacterial species in the genus Chlamydia. It is a genus of pathogenic bacteria that are obligate intracellular parasites. The C. trachomatis is a weakly gram-negative bacterium. They also possess an inner and outer membrane similar to gram-negative bacteria and have a lipopolysaccharide but do not have a peptidoglycan layer. It is ovoid in shape and non-motile. Bacteria are non-spore forming, but the elementary bodies act like spore when released into the host. Although they synthesize most of their metabolic intermediates, they are unable to make their own ATP and thus obligate parasites. So this is the Chlamydia trachomatis inclusion bodies, which is the brown, in a McCoy cell culture. So for the effect of the disease, trachoma, it is a chronic infection or repeated reinfection with Chlamydia trachomatis. It results in inflammation and follicle formation involving the entire conjunctiva. The scarring of the conjunctiva causes turning in of the eyelids and eventually scarring, ulceration, and blood vessel formation in the cornea resulting in blindness. While in the inclusion conjunctivitis, it is caused by Chlamydia trachomatis associated with genital infections. The infection is characterized by a mucopurulent discharge, corneal infiltrates, and occasional corneal vascularization. While in neonates, infection results from passage through an infection birth canal and becomes apparent after 5 to 12 days. Also, ear infection can accompany the ocular disease. And now let us move on to ocular lymphogranuloma venereum. It is an infection with Chlamydia trachomatis, which can lead to oculoglandular conjunctivitis. In addition, patients also have an associated lymphadenopathy. while in newborns, infant pneumonia. Infants infected with Trachomatis at birth can develop pneumonia. The children develop symptoms of wheezing and cough, but not fever. The disease is often preceded by neonatal conjunctivitis. So for urogenital infections, chlamydia is known as the silent epidemic, wherein the woman not cause any symptoms in 70 to 80% of cases. The symptoms are abnormal vaginal bleeding or discharge, abdominal pain, painful sexual intercourse or fever, painful urination or the urge to urinate more often than usual. Postpartum fever in infected mothers is common. Premature delivery and an increased rate of ectopic pregnancy due to self-meningitis can occur. While in men, infection shows symptoms in 50% of cases. The symptoms are a painful or burning sensation when urinating, discharge from penis, testicular pain or swelling or fever. Chlamydia in men can spread to testicles, causing epididymitis, which can lead to sterility. Also, chlamydia is also a potential cause of prostatic inflammation in men. For the molecular tests available, nucleic acid amplification test or the NNAT, which is the polymerase chain reaction, is recommended. And for the culture, the most specific method for diagnosis of C. trachomatis, the infected cells are examined for the presence of iodine staining inclusion bodies. The iodine stains glycogen in the inclusion bodies. The presence of iodine staining inclusion bodies is specific for C. trachomatis since the inclusion bodies of the other species of chlamydia do not contain glycogen and stain with iodine. And for the antigen detection, direct immunofluorescence and ELISA kits that detect the group-specific or strain-specific outer membrane proteins are available for diagnosis. Neither is as good as culture, particularly with samples containing few organisms in asymptomatic patients, while in serology, serological tests for diagnosis are of limited value in adults since the tests do not distinguish between the current and past infections. Detection of higher titer IgM antibodies is indicative of a recent infection, while the detection of IgM antibodies in neonatal infection is useful. And for the treatment, tetracyclines, erythromycins, and sulfonamides are used for treatment, but they are of limited value in endemic areas wherein reinfection is common. Vaccines are of little value and are not used. Treatment coupled with improvement sanitation to prevent reinfection is the best way to control infection. Also, the safe sexual practices and prompt treatment of symptomatic patients and their sexual partners can prevent genital infections. Also, the use of condoms or having sex with only one person who is not infected. And that is all from my report.